What we've done, very wisely, is we've kept our rock star until after lunch. And I mentioned Suzi this morning, and so Suzi's going to come up and she's going to talk to us about improving access to healthcare for Tasmanians living with multiple sclerosis in remote areas.
Hello, can everyone hear me? That was quite an introduction. Thank you, Des. I'm not sure I'm going to live up to it, but I'll try and keep my sheer enthusiasm will hopefully keep you awake through this whole presentation. That's what I'm bringing to the table. That in half of another person. So today I'm going to be talking to you about the Tasmanian MS Remoteness study. And as, ooh, I don't know what happened there. Here we go. Nope. I've gone the other way. There we go. There we go. So I am the life-size version of this photo. I am a postdoctoral research fellow at the Menzies Institute in the MS flagship. And before I get going, I'd really like to acknowledge the Royal Hobart Research Foundation, who have really generously funded the research I'm about to talk about. So why are we interested in remoteness, and what does remoteness mean? So we've heard it a bit in some of the other presentations today. What does it mean? This map is made by the Australian federal government, and the sandier colors indicate remote areas. The dark green colors indicate areas of more population, and that's exactly how the Australian government designates remoteness. They calculate it by saying, how far away are you from areas of population centers? So just how many people live in a particular place? Are you close to places where lots of people live? And they use that as a proxy for resources, because the assumption is where there are people, there are things. So if we zoom in on the part of the map that we really care about, which is Tasmania, you can see that there are no major cities, according to the Australian federal government. I'm sorry, Hobart. What Tasmania is made up of regional and remote areas. So Tasmania is actually the most regional state in Australia because it doesn't have a major city. It's also the most decentralized. So 60% of Tasmanians do not live in Hobart, and that's unusual for Australian states. So people are spread out more than in some other Australian states. And why is remoteness important in the context of health? Why are we talking about it? Why are we thinking about it? Why are we measuring it? We're interested in it because life expectancy is lower in very remote areas compared to major cities. And this table was created by the Australian federal government, and it shows that there is a 5-year difference for males and a 4-year difference for females between very remote areas and major cities, with people living in very remote areas having a shorter life expectancy. So if we look under the hood of why that might be, why we might see that difference in life expectancy, what we see immediately is there's a big difference in what's called disease burden. And disease burden counts 2 different things. It counts the number of years of healthy life lost due to living with illness, and it also counts the number of years lost to premature death. And the table you can see here shows the disease burden for a number of different diseases across different remotenesses. And for some reason, despite the fact that the Australian government also made this graph, they used the reverse legend. So the dark green bars are actually really remote areas on this graph. If I ever talk to these people, I'm going to tell them that they need to change it. But for the minute, I'm just using their table. And what you can see is that there's some variability between diseases. So the differences are not the same across all diseases. But overall, there's a really clear pattern. And the overall disease burden is 1.4 times higher in very remote areas than in major cities. So what we're trying to do is to evaluate the effect of remoteness, which means living far away from resources, on the access to and satisfaction with healthcare and support services among Tasmanians living with multiple sclerosis. So we're interested in talking to as many people as we can living with MS in Tasmania to get a sense of how where you live affects the care you receive and how you go. So why do we think that remoteness might be important for multiple sclerosis in particular? Well, there's a couple reasons, and as we all know, disease course of multiple sclerosis can extend for a really long period of time, for decades. So your access to care over periods of time can be really important. In addition to that, the treatments that are available for relapsing onset MS have been shown to be most effective when they're used early. And some of those treatments require things like infusion. So you need to have access to an infusion center to make it possible to take those treatments. So all of those things tell us that access to care may be really important for people living with MS in particular. Not only that, but in Tasmania, MS-related resources are fairly concentrated. So I made this map, and it just used Google Maps. But what it shows us is there are 2 MS clinics in Tasmania, at the Royal Hobart and at the Launceston General Hospital. And there are 2 MS Limited offices, which is, as we know, the primary service provider for people with MS in Tasmania. Those are also in Launceston and Hobart. And there are 4 major infusion centers. There are other places you can receive infusion, but there are 4 major centers, and those are in Hobart, Launceston, Burnie, and Devonport. So there are big areas of the state where you may be fairly far away from those resources. So living remotely is possible for people with MS in Tasmania. So in this project, we're hoping to talk to people from Launceston, Hobart, Queenstown, Swansea, everywhere in between, to get a sense of what access to care looks like for people with MS in Tasmania. And we'll do that as simply as we can using an online survey that takes about 30 minutes to complete. And in that survey, we'll ask you questions about where you live to get a sense of your geographical remoteness, so your remoteness based on where you live, your practical remoteness, which means how long it takes you to get to healthcare resources. So that might be the same for someone who lives in Queenstown as it is for someone who lives a little ways outside Hobart but has to take public transportation because they don't have access to a car. That may also take them quite a long time to get to healthcare resources. We'll also be asking about your ability to access healthcare and support services. We'll be asking about your satisfaction with that care. And we'll be asking about health outcomes like disability and quality of life. So we've already started recruitment for this study. I feel like you all have been bombarded with requests for your participation, but I'm going to ask you again to take part. You can join this study. It's underway right now, and it only requires doing a 30-minute survey. Oh, I keep going backwards. So this project is a partnership between Multiple Sclerosis Limited and the 2 MS clinics, the one at the LGH and the Royal Hobart and Menzies. And the project's partners are represented by Des Graham, Bruce Taylor, and Lauren Giles, many of whom you will already know. We're hoping that when we gather all of this data, it will allow us to do a few different things. It will allow us to use it as pilot data to get national data on this exact topic of looking at how remoteness impacts people with MS across Australia. We're hoping that it will allow us to make recommendations on practice for both the MS clinics and MS Limited so that they can improve their care provision to people living with MS in the state. In the long term, we're hoping that it will allow us to advocate for inclusion of remoteness as a special consideration in schemes like the NDIS. We're also hoping it might serve as a blueprint for studies like this in other diseases like diabetes. So how can you get involved? I've already told you a bit. You can get involved by taking part. You can sign up for the study at Trade Table 2. There are flyers in your delegate packs. So you can also get involved by emailing me after the event, and I'll send you a link to the survey. You can also get involved by spreading the word. You can take a bunch of flyers. Feel free to tell anyone you know who's living with MS in Tasmania because they're eligible to take part. With that, I'd like to thank all of our project contributors and project funders, and of course, the people who've made this event possible. And I'd like to take your questions.